Understanding health insurance plans for families. Ever feel lost in the maze of health insurance? Don't worry, you're not alone. This video will break down the basics, helping you choose the best plan for your family's health and financial security. Let's dive into the world of health insurance plans. Understanding the different types is the first step to making an informed decision. We'll cover HMOs, PPOs, and EPOs. HMOs are often the most budget-friendly option. They emphasize coordinated care within a specific network. This can lead to lower out-of-pocket costs. With an HMO, you'll need to choose a primary care physician, PCP. Your PCP acts as your main point of contact for healthcare. They coordinate your care and provide referrals to specialists. Referrals are key with HMOs. You'll generally need a referral from your PCP to see a specialist. This ensures that your care is managed effectively. HMOs have a limited network of doctors and hospitals. Staying within this network is crucial for coverage. Going out of network could mean paying the full cost of care. Because of the managed care and limited network, HMOs usually have lower premiums. This makes them an attractive option for families on a tight budget. PPOs offer more flexibility than HMOs. You have the freedom to see specialists without a referral. This can be a big advantage for families with specific healthcare needs. One of the biggest benefits of a PPO is the ability to see out-of-network providers. However, keep in mind that this comes at a higher cost. Your insurance will cover less of the bill. While you can see out-of-network providers, staying in-network is still more cost-effective. In-network providers have agreed to discounted rates with the insurance company. PPOs typically have higher premiums compared to HMOs. This reflects the greater flexibility and choice they offer. Consider if the added flexibility is worth the extra cost for your family. The freedom to choose your own doctors and specialists is a major draw for many families. PPOs provide this freedom, but it comes with a higher price tag. EPOs offer a hybrid approach between HMOs and PPOs. They combine some of the cost savings of HMOs with some of the flexibility of PPOs. It's a good middle ground for some families. Like HMOs, EPOs have a network of providers. You'll need to choose doctors and hospitals within this network. Staying in-network is essential for coverage. However, unlike HMOs, EPOs generally don't require you to choose a PCP. You can see specialists without a referral. This offers more convenience and control over your healthcare. EPOs often have lower premiums than PPOs. This makes them a more affordable option for families who want some flexibility without the high cost. The key with EPOs is to understand the network. Make sure your preferred doctors and hospitals are included. This will ensure you can access the care you need. Choosing the right health insurance plan involves more than just picking a type. You need to understand the key cost factors. Let's break down premiums, deductibles, copays, and coinsurance. Premiums are the monthly cost of your insurance. Think of it as your monthly subscription fee for healthcare coverage. This is a fixed cost you'll pay regardless of how much healthcare you use. Higher premiums often mean lower out-of-pocket costs when you need care. Lower premiums usually mean higher deductibles and copays. It's a balancing act to find what works best for your family. Consider your family's budget when choosing a plan. Can you afford a higher premium for more comprehensive coverage? Or do you need a lower premium, even if it means higher out-of-pocket costs later? The deductible is the amount you pay out of pocket before your insurance starts to pay. It's like a threshold you need to meet before your coverage kicks in. For example, if your deductible is $2,000, you'll need to pay $2,000 in medical expenses before your insurance starts covering costs. This can be a significant expense, so plan accordingly. Plans with lower deductibles usually have higher premiums. Plans with higher deductibles usually have lower premiums. Consider how much you're willing to pay upfront versus over time. Copays are fixed fees you pay for certain services, like doctor visits. It's a set amount you pay each time you receive that service. For example, you might have a $25 copay for a visit to your primary care physician. This is a predictable cost that can help you budget for healthcare expenses. Copays don't usually count towards your deductible. They're separate fees you pay at the time of service. Understanding your copays is important for managing your healthcare costs. Coinsurance is the percentage you pay for covered services after you've met your deductible. It's a way of sharing the cost of care with your insurance company. For example, if your coinsurance is 20%, you'll pay 20% of the cost of covered services, and your insurance will pay the remaining 80%. This continues until you reach your out-of-pocket maximum. Coinsurance can vary depending on the service. Some services might have a higher coinsurance percentage than others. Be sure to check your plan details to understand your coinsurance responsibilities. Choosing the right health insurance plan requires a careful assessment of your family's healthcare needs. Consider factors like the number of family members, ages, and pre-existing conditions. Think about how often your family members typically need medical care. Do you have young children who require frequent checkups? Or do you have family members with chronic conditions that require ongoing treatment? Consider the ages of your family members. Young children often need more frequent doctor visits and vaccinations. Older adults may require more specialized care. Pre-existing conditions are a crucial factor to consider. Make sure the plan you choose covers the necessary treatments and medications for any pre-existing conditions. Anticipate your family's healthcare usage for the coming year. Are there any planned surgeries or procedures? This can help you determine the appropriate level of coverage. Prescription drug coverage is essential for many families. Check the plan's formulary to make sure your family's medications are covered. Also, compare the costs of different plans. Mental health services are increasingly important. Make sure the plan you choose offers adequate coverage for mental health care. This includes therapy, counseling, and psychiatric services. Preventative care is key to maintaining good health. Choose a plan that covers preventative services like annual checkups, screenings, and vaccinations. This can help you catch potential health problems early. Navigating the world of health insurance can be overwhelming, but there are resources available to help. The health insurance marketplace and state-based exchanges are great places to start. The health insurance marketplace, healthcare.gov, allows you to compare plans and enroll in coverage. It's a valuable tool for finding affordable health insurance options. Many states have their own health insurance exchanges. These exchanges offer similar services to the federal marketplace. Check if your state has its own exchange for more localized options. Take the time to compare different plans. Look at the premiums, deductibles, co-pays, and coinsurance. Consider your family's specific healthcare needs and budget. Remember to understand the different plan types. HMOs, PPOs, and EPOs each have their own advantages and disadvantages. Choose the plan that best fits your family's needs and preferences. Comparing costs is crucial. Don't just focus on the premium. Consider the potential out-of-pocket costs, such as deductibles and co-pays. This will give you a more accurate picture of the total cost of care. Ultimately, the best health insurance plan is the one that provides the right coverage at a price you can afford. Consider your family's specific healthcare needs and financial situation. Choosing the right health insurance plan is a critical decision. It can protect your family's health and financial well-being. Take the time to research your options and make an informed choice. Ready to take control of your family's health insurance? Explore your options and compare plans. Don't wait. Protect your loved ones and secure your financial future.